Why not go to the cheapest place? Well, it's your sight. It's your vision. And, okay, so here's another little story. A woman went one time to a famous hat designer. And he designed me the most beautiful hat. He put on just a regular hat. And he took a lovely piece of ribbon and he sort of draped it so and pinned it here and had it all set up. And it was truly beautiful. And she said, that's magnificent. And he said, that's $1,000. He goes, well, wait a minute, $1,000? It's just a ribbon. And so he said, oh, no problem. And he takes the ribbon off, he unfolds it, he unpins it, he takes the hat completely apart, rolls up the ribbon and hands it to her and says, that'll be $5. And you see the difference. What we do is certainly the surgery, but it's also the care before the case. It's the diagnosis. It's helping pick the right procedure. It's having the right procedure, every procedure. We have virtually everything for that patient. So we're able to take the best procedure for that individual patient. It's not just a factory. Everybody doesn't get LASIK. They might get SMILE, they might get PRK, they might get something else. But it's the diagnosis, the care, the picking of the procedure, the surgery itself, certainly. But then it's the aftercare. It's doing any touch-ups. It's the follow-up. If I were picking a surgeon to do my LASIK, I haven't had LASIK, but if I were picking a surgeon to have surgery, certainly I would want somebody who was good and ethical and had done a lot and that I felt comfortable with. But you brought it up, and people don't usually bring it up. Key to me would be picking someone that if things didn't go right, they could take care of it. I've done a lot of live surgery. I mean, I think I've done as much live surgery within the LASIK courses and meetings as anybody I know. And I've visited a lot of surgeons. And there are surgeons who can just nail out case after case after case. But if the case doesn't go well, they're completely flummoxed. They can't shift gears. They can't go into a different mode. They don't have the tools or the patience or the training to do what they need to do. So they just kind of keep going forward. I would want the surgeon who, if there were a complication, God forbid, would take care of that, could take care of that. So you really hit upon a very good point there. One that I've thought about a lot of times myself.